First, we need to establish that we have nothing against rapid tests, but since the beginning, especially in the second wave, where we have been able now to test 35,000, 40,000 a day, and even more than that, we don't need additional tests than the one that are very, very strong and very reliable are the PCR tests. So our first point is we don't need that. Where we would need, and this is the reason we have made this choice, that we don't need to use the rapid test, okay, because they are not as reliable. And this is the reason why a lot of provinces have made those same choices, that they're saying, well, we don't need them unless we are missing tests. But in our case, we don't miss tests. And that's the reason that so far we have made that choice, that we're not using them for the massive testing as we have been doing since the beginning of the second wave.
And maybe I will add something.
Yes, please.
I take a chance, because what I heard, what I understood is that the rapid tests are slow tests to take the test. All right, it's faster to get the result, but if you want to test 10 people, it's faster to use the regular test than what they call the rapid test. So the rapid test is a slow test in a way.
But I just want to add something that I said in French, so I want to make sure that English people speaking to understand.
Thank you.
There is no problem of access to testing actually in Quebec, as we had in springtime. And actually there is no cold going on. So if you are sick, if you have symptoms of cold, if your son is sick, please get isolated, go take a test and take care of the result, and public health will call you back, because it's very important. We see that people are getting less tested, but it's not because there is no capacity. So I think it's very important that people remains that. And at the same time, even if we have big measures, don't forget, even every day, even in contact with your family, elderly people, as told the Prime Minister, it's important to get the distance of 2 meters, the mask, and hygiene. This is critical. It is critical even if the numbers are going to go down. There's still a big impact on the healthcare system, and we don't want people to have problems, not access to care, because we won't do the job. The vaccine is going to help us a lot, but you must keep your strict hand hygiene, masks, and I would say distanciation. Don't forget that at work, even during break time, when sometimes people at the dinner time, they take off their mask and they eat together. This is a risky condition with the virus circulating as much as it is in Quebec everywhere.